Have you heard about the latest NHS prescription changes? Imagine waking up one morning to discover that the medications you've depended on for years are suddenly no longer covered. For many British seniors managing multiple health conditions, this nightmare is fast becoming a chilling reality. Today, we are exposing the full list of cut prescriptions that the mainstream media isn't talking about, and revealing exactly how these changes specifically target our most vulnerable elderly population. The government claims these cuts will save money. But at what cost? If you or your loved ones are over 65 and living with multiple health conditions, you must watch this entire report. Before your next pharmacy visit leaves you facing impossible choices between essential medications and your own health, you need to hear everything we are about to reveal. The recent NHS announcement has sent shockwaves through communities across the UK. For decades, Britain has prided itself on a healthcare system that takes care of everyone, regardless of income, background, or age. But these new prescription policies tell a very different, and frankly, devastating story. Seniors with 3 or more chronic conditions, and that's over 3 million people across the country, are discovering that medications they've relied on for years are now being quietly reclassified as low priority or even non-essential. What exactly is happening here? Under the new NHS prescription guidelines, medications for certain chronic conditions are being removed from standard coverage when patients have multiple diagnoses. The official explanation is that this will streamline care and reduce over-medication. But the reality, when you dig beneath the headlines, is far more concerning. Let's look at what this really means for someone like Margaret, a 78-year-old widow from Leeds. She lives with arthritis, type 2 diabetes, and hypertension conditions that millions of our seniors struggle with every single day. Before these changes, Margaret's monthly prescriptions were fully covered under the NHS. Now, she's being told that some of her arthritis medications are considered secondary treatments because of her other conditions. She'll either have to pay out of pocket, find cheaper alternatives, or risk going without. Is this fair? Is this what our national healthcare system was built to do? Abandon seniors at their most vulnerable moments? I don't think so. And I suspect you don't either. Why is this happening now? The truth is, the NHS is facing unprecedented budget pressures. An aging population, rising costs for advanced treatments, and years of financial strain have pushed the system to the brink. But is cutting essential medications for our seniors, the very people who have contributed to this country their entire lives, really the answer? According to Dr. James Holloway, a respected geriatric specialist, these cuts disproportionately affect elderly patients with complex needs. These are precisely the people least able to navigate confusing new rules or absorb additional, out-of-pocket costs. What's most shocking of all is how little attention this issue has received in mainstream coverage. While news headlines focus on waiting times and hospital staffing shortages, this quiet fundamental shift in prescription coverage has gone largely unnoticed. That ends today. Here's what you absolutely need to know. These changes affect medications across several major categories, with particularly devastating impacts on treatments for arthritis, certain gastrointestinal conditions, mild to moderate pain management, and some cardiovascular supportive medications. The full list is long and complex, but let's talk specifics. For arthritis patients, certain non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, such as naproxen and diclofenac, are being targeted. Especially when prescribed alongside medications for other conditions, these drugs are being downgraded. Specialized versions, including topical gels and creams, are being reclassified as self-care items. That means patients must now purchase them themselves, regardless of cost. For gastrointestinal conditions, drugs like omeprazole and lansoprazole critical proton pump inhibitors that protect the stomach from damage are being heavily restricted. If a senior takes multiple medications, the NHS now considers their stomach protection to be optional. Optional, despite the fact that many medications, especially painkillers and heart drugs, can cause serious gastrointestinal harm without this protection. For pain management, drugs like tramadol and codeine-based medications are facing stricter controls. Patients who have previously relied on these medicines for manageable pain are being steered toward less effective or cheaper alternatives, even when they've already tried and failed them. For cardiovascular support, secondary medications that support blood pressure or cholesterol management are being dropped from standard coverage for patients with more than one diagnosis. But what does this all mean in real human terms? I spoke directly with several seniors impacted by these changes. Their stories are heartbreaking, and they deserve to be heard. Elizabeth, a 72-year-old pensioner from Cardiff, told me, "I've been taking the same combination of medications for my arthritis and heart condition for over a decade. My doctor says they work well together. Now I'm being told I can only get full coverage for my heart medication. If I want my arthritis treatment, I'll need to pay privately or switch to something that doesn't work as well. I'm on a fixed income. I simply can't afford it." Then there's Thomas, 81, from Edinburgh. He said, "My digestive medication is now considered optional because my diabetes and respiratory conditions take priority. But I need that medication just to be able to eat without terrible pain. How is that optional?" These stories raise a serious and urgent question. Who exactly is deciding which conditions deserve treatment and which ones can be ignored? When a person has multiple serious health conditions, how can we possibly separate their health needs into essential and non-essential boxes? They are all part of the same body, the same person. The NHS guidance says patients should speak with their GPs about alternatives. But many doctors are frustrated too. Dr. Sarah Patel, a GP from Manchester, told me, "We're being asked to make impossible choices for our patients. These aren't isolated illnesses. They're interconnected. Forcing elderly patients to prioritize treatment for one condition over another goes against everything we know about proper care. The human cost here is immeasurable." Confused seniors are being left to navigate a maze of changing prescriptions, unexpected charges, and uncertainty about whether the treatments they've depended on for years will still be available. Families are scrambling to figure out how to pay for suddenly uncovered medications. And perhaps most distressingly of all, some seniors are simply going without, choosing pain over poverty because they cannot afford both. This is the reality happening quietly, behind the scenes, in our communities today. Let's take a deeper look at the financial side of these cuts. According to NHS internal estimates, the goal is to save roughly £250 million annually through these prescription changes. But at what human cost? £250 million sounds like a big number. But when you consider the massive scale of NHS spending overall, it represents a mere fraction of the budget. Is it really worth sacrificing the health and dignity of 2.3 million seniors to scrape together budgetary savings that barely move the needle? Experts say absolutely not. In fact, many warn that cutting essential medications will actually increase overall NHS costs in the long term. Seniors without proper medications are more likely to suffer serious health crises, resulting in hospitalizations, emergency care, and costly interventions that could have been avoided with proper medication management. Imagine Margaret from Leeds again. Without her arthritis medication, her mobility decreases. She falls and fractures her hip. Now she's hospitalized, undergoing surgery, and facing a long and expensive recovery. All because the NHS decided to save a few pounds by cutting her prescription coverage. It's a false economy, and one that puts lives at risk. It's also important to understand that these changes are not being rolled out evenly. Access to medications is beginning to vary dramatically between regions, depending on local NHS trust policies. That means your postcode could determine whether you can afford the medications you need to stay healthy. Some areas are moving faster and more aggressively with cuts. Others are trying to shield their senior populations as best they can, but resources are running thin. It's a dangerous game of healthcare roulette, and British seniors are the ones paying the price. As we investigate deeper, another shocking pattern emerges. These cuts disproportionately affect lower-income seniors the most. Wealthier patients may be able to absorb the cost of suddenly uncovered medications. But for those living on a fixed pension or relying solely on state support, even small additional expenses can be catastrophic. Prescription charges in England already add up quickly. And with inflation and living costs soaring, the last thing vulnerable seniors need is another financial burden. I want to be absolutely clear. No one is saying the NHS doesn't face real financial challenges. We all understand that hard choices sometimes need to be made. But when those hard choices consistently fall on the shoulders of our oldest, sickest, and most vulnerable citizens, something is deeply, profoundly wrong. The silence surrounding these changes is deafening. The media has barely scratched the surface. Official NHS communications have been vague, talking about optimizing prescribing practices and improving efficiency without ever explaining who loses out in this optimization. And politicians, eager to avoid backlash from the senior voting bloc, have been disturbingly quiet. That's why we are speaking out today. You deserve to know the truth. If you or someone you love has 3 or more chronic conditions, your access to essential medications is at risk right now. You need to speak to your GP immediately. You need to ask them directly whether any of your prescriptions are affected by the new rules. And you need to plan for potential changes in your medication regimen before you find yourself at the pharmacy counter, blindsided by an unexpected bill you can't afford. So where do we go from here? First, awareness is key. Share this information with everyone you know. Far too many seniors have no idea these changes are happening until it's too late. Knowledge is power, and right now, it could be life-saving. Second, demand action. Contact your local MP. Write to NHS trust leaders. Let them know that abandoning seniors is not an acceptable solution to budget problems. Third, stay vigilant. We will continue monitoring this situation closely and bringing you the latest updates as they happen. The NHS was built on a promise that no one would be denied the care they need based on their ability to pay. That promise is being quietly eroded before our very eyes. But together, we can fight back. We can stand up for our seniors, our families, and the very principles that make Britain's healthcare system worth fighting for. If you found this report valuable, please subscribe to the channel, hit the notification bell, and share this video widely. The truth must be heard. The stakes are simply too high for silence,